Alright, you should have all watched the Billing for Interns video that goes over the basic philosophy of billing. There's another level to that, and that's being able to click through everything in Athena, which looks a little bit different than the simplified billing worksheet that I gave you. So we're going to go through a couple of the examples that you've already reviewed on your worksheet, but we're going to go through what those would look like in Athena. This will also overlap with some of our quality metrics, which is another video that you'll watch to go over. So pay attention. If I mention something about quality metrics, just put a pin in it in your mind and you'll learn more about that in a separate video. To get through this video, I would recommend having your billing cheat sheet out, the two-sided document called Billing 1 and Billing 2, and then your other two-sided document that's got a little bit of info on well-child visits, and then the other side starts out by saying planned visits. So we're going to use both of these for this video, and then also the worksheet that you just completed will help guide you too. So let's begin. So for this first sample billing that you just went through, we talked about how that patient had acute otitis media. Well, I want to make note that in Athena, when you add the diagnosis of acute otitis media, by clicking this plus sign and searching acute otitis media, you'll be able to select something. Anytime you select a diagnosis that's not specific enough to be billed, you'll see a red bar pop up next to it, and then you'll have the option to click this ICD-10 code button. So what you would do normally is you would have searched AOM, selected it, and then you'd go in and click the ICD-10 code button. Once you've clicked that, you'll see there's an expanded box. Now what you need to do is select the more specific diagnosis. Now in the worksheet that we went through, I think the ICD-10 code I used was just H65.19. Well, in reality, we can be even more specific than that. And Athena forces you to do so by making that red box. And then when you clicked it, you can select H65.19. I didn't mention that the patient's AOM was on the right side. So the extra one just signifies that, yes, I identified this infection, but I also identified it on the right side. So you would have selected that if you were billing in Athena. So when you open that billing tab at the very end of your encounter, this is what you would see. Under E&M, you would have the opportunity to put in 99204, which we already talked about, is a new patient level 4. You would attach that E&M code to the ICD-10 code that was for acute otitis media that we just identified when we made our assessment and plan. Then you click this little button so you are identifying that yes, you want to bill for this. One thing we did not talk about in the previous video because it's either Athena or Ascension specific is this, PHQ2. If you click this button, this is what you'll see. Every patient that comes to our office is screened for depression. They're asked 2 questions, and that composes the PHQ2. When I click that button, I could see that the patient was screened, and that based on their screen, they were a negative screening for depression. There's a little X in this box, so I can click out of it, and I'm back to my billing tab. I need to bill for the fact that the MA did ask those 2 questions. So if I click this little box under PHQ2, I would have the option to select positive screening for depression or negative screening for depression. Well, when I click this, I could see clearly that the patient was negative screening for depression. So then in this drop-down box, I selected the negative screening for depression. But now I also need to attach that to an ICD-10 code, and it can be any code for that encounter. And I also need to check this little box saying, yes, I do want to bill for this. This is one of our quality measures that we'll talk about in a future video. We are communicating to the insurance company that we're an awesome office and we screen every patient that comes through the door for depression. But now there's another thing we have to do. Every patient that comes to our office, in addition to being screened for depression, also needs to be screened for obesity, and that's done simply by calculating their BMI. If you look on the left-hand side in this bar here, there's a heart, and that's vital signs. If you click that, it expands outwards, and now I can see what this patient's BMI was. This patient had a BMI of 22.5. Well, now I need to communicate to the insurance company that yes, I assessed this patient's BMI, and the only way for me to do that is to add it as an assessment. So what I would do is click this button, search BMI, and based on what their BMI looked like in the vital signs, I can select which one I want. So in this case, I want BMI of 20 to 24. If for some reason the search function's never working, if you use your billing cheat sheet, the very second set of ICD-10 codes are the BMI for adults. I'd like to make note that for children, we need to use a BMI percentile. So now I not only have the AOM, I also have the body mass as an assessment. If I go back to my billing tab, you can see that my 99204 is still selected, attached to the AOM code, and now it also has an attached BMI code to it. And yes, I was billing for that. The PHQ was completed in negative. I put in that billing code, and it's also attached to any old ICD-10, and the box was checked that yes, I want to bill for it. So now this is a complete billing tab in Athena. So it's a little bit more complicated than what we went over in the first video because there are a few extra requirements that we need to keep in mind for Ascension. Oh wait, one more thing. Now, every time you as a resident see a patient, you have to say in your note and on the billing sheet really that either the attending saw the patient with you or they did not. And that's done in this middle section called Modifiers. So every patient that's seen by a resident needs to have either the modifier GE or GC added into the very top next to the E&M code. So for your first year, you'll have a preceptor see all of your patients after you've seen them until January, and that indicates GC. Dr. McCready taught me a way to remember this, is that GC is C. The preceptor did see the patient. GE is that you did not. So then I add in the GC modifier. Wow, that was a lot. So let's recap everything you need to do for something as simple as acute otitis media. In addition to billing for the services you provide, that would be the E&M code attached to the diagnosis. You also need to add BMI as an assessment and then make sure it's on the billing sheet. Now that was, remember, attached to the same old E&M code that I used for AOM. You need to bill for the PHQ results. The MAs are automatically doing it for us. We just need to make sure we bill for it. And then you need to add the modifier GC. Did the preceptor see the patient? Or GE, they did not. Let's do another sample. So in our second example, this is even more complicated. Remember, we saw a well child, and you saw on your billing cheat sheet that the E&M code for well child was 99393, and that the ICD-10 code for that was Z00. It's actually got a couple other digits in it in real life, but to keep it simple, in the previous video we just did Z00. You don't need to worry about those extra digits because that will auto-populate in the well child template, which is another video. But we did more than just the well child visit. That patient also had a vision screen. So once the vision screen is ordered in Athena, which again is part of the template that's already populated, so you don't need to worry about how to do that, on the billing sheet you would have seen this option for other. If we look on our billing cheat sheet on billing side 2, the top of the middle column, we saw that the Snellen chart was 99173, so we inputted that in the box here. We attached it to the reason why we did it, which was the preventative visit, and we checked the box. What about depression screening? Well, if you look at your other sheet on the side that's got the table for pediatric well child visits, under depression screening, which is almost near the bottom, you'll see we only do that for kids 12 years and up. So this patient did not need the depression screening completed. What about BMI? Well, if you look at your billing cheat sheet on billing 1, the very, very top, you'll see that we use a BMI percentile for children. So if I clicked the vital sign of the tab here, and this was truly a kid, you would see a percentile here. Let's say this kid is in the 50th percentile. So now that I know that they're in the 50th percentile, I have to add that as an assessment. Unfortunately, if we just typed in BMI, you would get way too many options. It would be hard to search for it for a pediatric patient. So that's why on your billing cheat sheet, I have the percentiles for you. So a kid in the 50th percentile would have the ICD-10 code Z68.52. So I typed that in my diagnoses and I added it. You could have clicked either one of these and it would still be Z68.52. So now if I go back to my billing tab, I've still got my 99393 and it's attached to my Z00 for preventative visit, but now I also have the BMI percentile attached to it, and remember I clicked this box because yes, I'm billing for it. But remember, I still need to add in the GC code because my preceptor saw the patient with me. I did not need to do the PHQ because they're under the age of 12. And when it's finally finished, you can see I've got everything needed here. The 99393, which was the established preventative visit, GC, my preceptor saw the patient, the well-child ICD-10, the ICD-10 for the BMI percentile, the CPT code for the vision screening attached to the ICD-10 for well-child visit, and then I clicked the box because yes, I wanted to bill for these things. I know it's a lot, so we're going to do one more example. In example 3, we had a patient who had hypertension, hyperlipidemia, and diabetes, and I gave you the ICD-10 codes for that. The patient also had labs done for the diabetes. Now, if I had searched and added these, I would have found that a couple of them might have had that red bar, so I would have had to click the ICD-10 code and selected the most specific version of it. But I put all that in for you because you can do that when you actually see patients. So if I go to the billing tab, this is what it should look like. I told you it was an established level 4, so my E&M was 99214, and I saw the patient for 3 major reasons: for hypertension, hyperlipidemia, and diabetes. But then I had also added in that BMI code, so I put that here, clicked the box, yes, I'm billing for it, added in the modifier GC because my preceptor saw the patient. But then remember that patient also had a blood draw, so this is where I would add the 36415 for the blood draw. I attached that to the ICD-10 for diabetes because that's why I did the blood draw. I checked this box because I do want to bill for it. And then I also reviewed the PHQ. It was negative, so I selected negative screening for depression, or G8510. And then you can't see it because my goofy face is in the way, but I still checked the box here, and I could have selected any ICD-10 code to attach to the PHQ. So I know it's really complicated. Billing is a complex thing and it takes years to perfect. So interns and residents who are at level 1 of oversight in the clinic, I would really want you to review your billing one-on-one with the preceptor in person on the day that you saw that patient. So even though we have a 24-hour turnaround time for notes, after you've seen the patient, go ahead in and do the billing part, sit down with the preceptor one-on-one and make sure that you did it correctly. It's much easier to learn that way than to wait until the preceptor sends you the note back for you to try and figure out and interpret what they want you to fix. My only advice is to just keep trying, and these sheets that I gave you are really comprehensive. Almost anything you might come across is probably going to be on here. Good luck with billing, and I'm always here to help.